Back now in the town hall, and we are seeing more children test positive for the coronavirus. The American Academy of Pediatrics says kids accounted for nearly 21% of new cases in the U.S. over the past week.
Yeah, while children normally fare a lot better than adults in terms of symptoms, they can get really sick and they can also be carriers of the virus. Now, at the same time as we're getting that news, a lot of kids are heading back to in-person schooling and they're doing more extracurricular activities. And so we got some advice for parents today from Dr. Schulz.
He's pediatric medical director for Rochester Regional Health, which has hospitals, urgent care centers, and doctors' offices in 5 of our counties. So here's what he thinks parents need to know right now.
Symptoms that could go along with COVID are pretty widespread. The ones that we worry the most about are fever, sustained headaches that are unusual for your child, loss of taste or smell, or especially if they have any symptom and have had exposure recently to somebody with COVID, they should definitely stay home. Other symptoms that can go along with it are runny nose, cough, nausea, vomiting, diarrhea, decreased appetite, abdominal pain. There's fatigue and myalgia that can be a part of it, muscle aches and soreness. Any of those symptoms, it's best to get evaluated. We know that it's also allergy season now as well, and there's some crossover in those symptoms. Allergy symptoms might be a little bit more along the lines of sneezing and itchy nose, itchy eyes, some of those kind of things. But if there's any question, because we know the runny nose and congestion can certainly go between both, it's best to have your child evaluated to make sure that we're not introducing cases unnecessarily.
And one other important topic that he addressed today was the vaccine.
Dr. Schulz is recommending his patients 16 and up get a shot as soon as possible. And once it is approved for kids younger than 16, he's going to do the same for them.
The vaccine is our best way at getting to the other side of this pandemic. No questions asked. Even as variants are coming out, we're finding that the vaccine is maintaining efficacy. It's extremely important that we get as many people vaccinated as quickly as we can in order to protect against further spread, further development of new variants, those sorts of things. So I'm strongly encouraging all my patients. Right now it's 16 and up for Pfizer. We know that especially teenagers can be asymptomatic carriers of this, and having the vaccine helps reduce their risk of becoming an asymptomatic carrier or passing that on to somebody else. We're looking forward to the day when that age limit drops further and further, and we can get more and more children vaccinated as well. It's only going to help herd immunity to be able to be developed and decrease the risk of the pandemic continuing to spread.
And a bright spot in all of this, the doctor says that because of masking and social distancing, far fewer kids are coming in with ear infections, bronchiolitis, flu, and pneumonia.
Probably adults as well.
Yeah.